Hello, everyone.
Hi, this is Dr. David Clinton Baker, Victoria.
Hi, David. As you're entering in, feel free to introduce yourself in the chat, or as David just did, you can just say hi out loud, whatever you feel comfortable with. Hi, Christine from Vancouver. What do you do, Christine? And hi, Daisy, occupational therapist from Victoria, family medicine. Well, welcome, Christine. Hi, Carmel. I hope I said that right. Great. Hi, Madison and Maria. Okay, we'll just give it a couple more minutes and then we'll get started. All right, well, I hope that everyone is enjoying the beautiful weather outside. I'm Jillian, the Victoria South Island LTCI Program Manager. Welcome to our learning series event on advanced care planning. It is with great respect and appreciation that I am speaking to you from the traditional and ancestral territories of the Sauk Nation, where I'm lucky to work and live. Just a couple of quick housekeeping notes before we get started. First, please keep yourself muted. Background noise tends to carry and can amplify fairly quickly. That being said, if you have any questions during the evening, don't hesitate to unmute and jump in. We really like to keep these events as interactive as possible. There are CME credits available for tonight's session. Someone from the LTCI team will be reaching out next week to send you a certificate for your records. Towards the end of the evening, we will ask you to fill out a quick evaluation. It only takes a few moments and your feedback really helps us improve these events. Finally, just so you know, tonight's session is being recorded and will be posted on our website afterwards. Okay. So please welcome Kathleen Zimmerman and Michele Martin. Kathleen Zimmerman is the social work coordinator for Island Health's owned and operated long-term care sites across the island. She brings a wealth of experience from her time as a frontline social worker in long-term care, having worked at the Summit, Quadra Village, and Oak Bay Lodge. Before moving into long-term care, Kathleen was an acute care social worker at Royal Jubilee Hospital. It was there that she developed her passion for advanced care planning through her roles in the outpatient renal dialysis unit, the amputee clinic, the orthopedic and rehab units, and as the after-hours on-call social worker for the ER, ICU, and CCU. Michele Martin is the social work regional practice resource for long-term care. She primarily supports social workers in Island Health's owned and operated locations, but also makes herself available to those working at affiliate sites. Michele also leads the monthly community of practice meetings for all long-term care social workers across the island. Michele has been practicing in social work for long-term care for the past 5 years, following a variety of roles in education. Recently, Michele completed her master's in social work at the University of Waterloo, focusing on social work in healthcare settings, and was honored with the MSW Award of Excellence. Throughout her career, Michele has had the privilege of being part of many conversations around advanced care planning, a topic she is deeply passionate about. Michele believes these discussions should become a routine part of life, no matter our age or stage. She is thrilled to be here today, contributing to the ongoing integration of advanced care planning into practice and supporting the use of tools that help communicate these plans across Island Health programs. Okay, so I will pass it over to Michele and Kathleen. Again, please just pop into the chat or go ahead and just speak out if you have any questions along the way. Enjoy.
Thank you so much, Jillian, and to the LTCI for having us. We are really excited to be here. I've met some of you. I recognize some of the names in the group here, so it's really nice to see that you've joined us today. I was part of the recent LTCI meeting that we had in October, I think that was, over at the that lovely hotel downtown where we did the presentation. So some of you may remember me from there. And all right, well, let's get started. As it happens, April 16th is National Advanced Care Planning Day. I swear we didn't plan this. It just was a coincidence that that's how things worked out. So it's very timely that we're having this discussion with you today. All right, Michele, you want to move? Okay, there we go. So many people are very confused about the different roles and responsibilities involved in advanced care planning. I've noticed working with some nurses and some physicians, nurse practitioners as well, that it's still a bit fuzzy sometimes about, you know, who can make healthcare decision, who makes financial decisions. And British Columbia has different rules than some other provinces where people might have gone to medical school or may have moved from. So we wanted to make a presentation. This originally started for a group of nurse practitioners who asked for some education around this. So I'm glad to see that it's kind of snowballed into a bit of a even bigger discussion. So what we're going to do is go through all of the different elements of advanced care planning and help you to be able to identify who the right people would be, as well as where to find this information in our Island Health uses PowerChart as our electronic health record. So if you're part of Island Health, then you should be familiar with that, and we'll show you how to use that tool and where to find that information. So like Jillian said, please feel free to come off mute and ask us questions or pop it in the chat throughout our presentation. Okay, next slide, please. Okay, so if you have a healthcare decision for your resident or your patient, who would be your first choice that you would go to answer your question? Anybody wants to come off mute and let us know who they'd go to first?
I would go to the patient themselves.
Excellent. Gold star. Yes. Your first choice should always be a capable adult, and we should always be assuming that everyone is capable. At each interaction, we need to assume that they're capable, and if we notice, oh, maybe they're not understanding, then we look at the next option. So who would be the next option that you would look at if you found out that your patient or your resident was not capable? Anybody want to guess?
Hi, it's Maria. I would look to see if there's a legally appointed substitute decision maker.
That's a very, very good guess. There is kind of a hierarchy of legally appointed substitute decision makers. Do you know who the highest one is for healthcare decisions?
Committee of person.
You got it.
Yes.
Yeah. Now Maria's a social worker, so she knows these things. And yes, so the committee of person is the next best option if an adult is not capable themselves, because that means that someone has gone to petition the court to say this person is no longer capable and here's why, and they've provided all these medical documents, and the court has decided that this person is not capable, and then they've appointed somebody else to make their healthcare decisions. So that really is your next best option if you can't get consent or a decision from a capable adult. After that, who would you go to if they're not capable and they don't have a comity of person?
A designated medical substitute decision maker.
That's a good guess. So when you're saying designated, so what the answer I'm looking for is that it is a health representative that has, it's a legal document that someone has signed, and the Section 9 of the Health Representation Agreement is the next best one after the comity of person. And Section 9 requires a lot more capacity to be able to appoint somebody. So sometimes you may have a resident that you think, oh, I don't know if they have the ability to make a health rep 9. Sometimes what a lawyer or notary might suggest is that you can look at another section, Section 7, which is if they have less capacity, like this one requires that the person be able to identify, okay, I trust my sister, or this is somebody that I want to handle my affairs for, but they may not have ever had very much capacity. I think the original intent of that legislation was around people with developmental delays when they, from birth. So maybe setting up a plan for them to be able to have representation from a family member or another trusted adult. So Section 7, it does have less power, and we sometimes have some trouble with that one if the Section 7 is also helping with banking. But that's another slide. We'll get to that one next. Okay, so if none of these options are available, we want to look for a temporary substitute decision maker. And does anyone know who would be the highest ranked TSDM? You can come off mute if you want.
Spouse, I think.
Yes, indeed, a spouse. And that also includes common law spouses. I had a situation when I worked at a stroke rehab in Vancouver where a man had been living with his girlfriend for maybe a couple months, but not a very long time. And he had a stroke, and there were some healthcare decisions to be made. But because they were cohabitating, this woman, the girlfriend, was deemed to be his TSDM, even though he had adult children who felt very strongly that he would want different interventions. So it was very challenging. We contacted the public guardian, and they said, well, if this person lives with the patient, even though it hasn't been a very long time, they constitute their spouse. So be careful who you live with if you don't want people that you're randomly living with to make healthcare decisions for you. I mean, they were living in a marriage-like relationship, but it didn't need to be for 2 years, which was surprising to me. Okay, so this is the list of the TSDMs in ranked order. And so if you haven't made your advanced care planning documents yet, and you're relying on the healthcare team to have to go through the TSDM list, you want to make sure that if someone is higher ranked than someone that you would want, then you should probably make a representation agreement now, so that we're not needing to try and sort that out for you later if you're ever in a position that you are unable to make decisions for yourself. I want to really emphasize here, because it came up recently at a care conference that I was facilitating, that the adult child, it doesn't matter whether they're the youngest child or the oldest child or the male or female, that birth order does not matter. So if there's the oldest daughter and she says, well, it should be me, I'm the oldest daughter, and the younger son, yeah, and the younger son says, oh no, it should be me. It's really, yeah, there's lots of good questions in here. Yeah, it would be a discussion with the social worker and the care providers to try and figure out, okay, who meets this criteria? Because unfortunately, there's a lot of conflict between equally ranked TSDMs. And so there are things that would disqualify you from being a TSDM, which I think are on the next slide, so we can go through that. So to qualify, you have to be 19. You have to be an adult, and you have to have been in contact with them in the preceding 12 months. And an interesting fact that I found out a couple of years ago from the public guardian as well was that I had a resident who had kind of been estranged from his family. I think he had some mental health issues and advancing dementia as well. And so he hadn't been reaching out to his family, but his daughter every Christmas and birthday was sending him a letter and really trying to make an effort to have a relationship with him, but he didn't really have the capacity to make a have a relationship with her, unfortunately. But the public guardian did rule that she qualified as a TSDM because she'd been sending those postcards and the Christmas letters, and she was trying to make an effort to have a contact with him. And so having no dispute with the adult is also a tricky one, because some people, as if they have major neurocognitive disorder, as their disease progresses, they may become more suspicious and accusing some of their family of stealing from them. So it can be challenging to try and really tease out, is this a real dispute, or is this part of this person's impaired thinking that is contributing to them thinking that they have a dispute with this, with their family or whoever it may be. And so, yeah, I saw some questions come up in the chat that were really good. Let me just see if I answered them. Okay, what if the children disagree on something? Yes, that happens, unfortunately, quite a lot. Stepchildren. So stepchildren still count as children. If I think we would, go back to the other slide, Michelle, can you? Let me see where we'd fit them in. Yeah, I mean, they're adult child. Yeah, it should still count, whether they're adopted or stepchildren or biological children. I think it should still count it. Michelle, do you know any differing opinions?
I'd have to double check, but I'm wondering
Okay.
if it maybe falls under a person immediately related to the adult by marriage.
Yeah, that sounds like it would. Yeah. I know that we've certainly taken direction from stepchildren and adopted children when they were the most appropriate TSDM. So, would it be okay if we get a copy of this PowerPoint? Yes, I was planning to send that out. Or I'm sure the LTCI can send it out. That would be fine with us. Does contact have to be in person, or can it be by phone? Yeah, it can be by phone. It can be by postcard. It can be by any kind of method that there is contact. Okay, thanks. Can you go back to the other slide, Michelle? Okay, next one. Okay, thank you.
Yeah, okay, I think this is me. So Kathleen kind of covered the overview of our healthcare consent, healthcare decision-making. But what about financial and legal decisions? Who to ask? So as healthcare providers, this might come up a little less often, but occasionally we might need to know who to contact about financial decisions. In long-term care, this comes up a little bit more than other areas of the health authority. The key point of this is to know that there is completely different legislation that governs who can make decisions for financial matters, with the exception of that health representation agreement, section 7, which I'll go over in a little bit more detail as well. But similarly to healthcare, there is a hierarchy of people that you would contact about this. So just like healthcare, the first person that you would want to go to about their legal and financial decisions would be a capable adult. If an adult is incapable, the next highest option, again, very similar to healthcare decisions, is the committee of estate. So this is similar to committeeship appointed for person, but notice that this one is of estate. So the same person could be appointed as a committee of person and a committee of estate, but they are not the same and they do not have the same powers. So make sure that you understand that there are two different committeeships. And again, this one is petitioned by the court and appointed, and they will appoint a representative.
Excuse me.
Of course.
I'm finding you a little garbled. Is your mic
I'm
maybe
garbled.
a distance away?
It's right in front of me. I have it on my headphones here. It's funny, I haven't ever received that feedback. Maybe if Kathleen, can you hear me okay? Is it okay? That's good. I'll hold it out like this. Hopefully that helps. I think it was Laura who made that.
Yeah, sorry, my internet then went glitch.
Oh, okay. I hope it's okay.
That is a bit better, yes.
Good. I'll try and speak clearly and loudly as well. Okay, so after committee of estate, we have an enduring power of attorney. So this one is the most commonly known, and sometimes what is mistaken for having powers over healthcare decisions, but it is not. So in the power of attorney that's made in the province of British Columbia only has powers over financial and legal decisions, and only while they are alive. So once someone passes away, there's different legislation that comes into play in terms of who's making decisions regarding disposition of someone's remains and their estate. So we'll talk a little bit more about that later, as well as an important part of advanced care planning. After an enduring power of attorney, so these are in ranked order of what responsibilities or how much power someone can have, what kind of decision-making power they'll have. So the next one is a representation agreement 7. So this one has the least amount of powers. They can basically be responsible for routine financial management, and some banks don't respect them and will not give access to bank accounts, unfortunately. But like Kathleen said, they can be more accessible for folks who may not be able to have the capacity for signing a power of attorney, for example. And then lastly, we have pension trusteeship, which can be applied through Service Canada for redirection of CPP, OAS, and GIS to that individual named as the pension trustee, and they can manage that for you. So this one can be done after someone becomes incapable. It's an option, and it requires usually a physician to fill out a certificate of incapability, which we'll talk about also. All right, and because there are so many options, the Public Guardian Trustee offers handy resources for folks to go through the different options for advanced care planning. This is a kind of a cheat sheet chart, and like we said, we will hopefully make this PowerPoint available to you. It's also available on their website, although you have to do some digging to find it. So something to note is that pension trusteeship, TSDM, and SDM are all enacted when someone is incapable, but someone must be capable to create an informal resolution, a power of attorney, and a health rep. So you can see that on the far right side of the screen there. Health Rep 7 is not for people who are incapable, but rather adopts a broader view of capability. This is what we were kind of talking about. It's inclusive to those with cognitive difficulties, and the legislation actually sets out factors to determining if someone can make a Rep 7. So that's all laid out for us. And now Kathleen's going to talk about the different types of incapability assessment or forms.
Yes, I was finding that I was getting mixed up with all the different forms that are called incapability assessments. And so I figured if I was getting mixed up, then other people must be as well. And so I made this kind of tool so you can see them side by side, that they're different and they do different things. So I'm going to go through each one so that you know what form you're filling out and what legislation it applies to, and you know, what is it for. So the first one, if you want to go to the next slide, Michele. Yeah, okay. This is the certificate of incapability. And you may have seen this come across your desk if you're a physician or a lawyer, or member of the clergy. This is for finances. So this is for the Canadian federal government to be able to appoint a pension trustee to manage someone's very basic pensions on Canada's Canada Pension Plan, Old Age Security, and Guaranteed Income Supplement. So this form, it doesn't require a whole lot of assessment. It's one, or I think there's a second page with your signature, but it's 2 pages that you can say, you know, this person cannot manage their finances, and it's basically you explain what their impairment is, their diagnosis, and when it began, and then you can send it off to Service Canada. It will take about a year for them to process it, to be honest. It takes a while. Some of you may have heard of the Bloom Group, which is a pension trustee organization based out of Vancouver, but they essentially act as pension trustees for folks who can't manage their finances. So if you see, you know, somewhere in the charting, oh, this resident's been referred to the Bloom Group, you can kind of ballpark that it's going to be about a year before they get their pensions redirected to the pension trustee to be able to manage them for them. Sometimes it's a family member that fills out, or, you know, gets this process going and gets their family doctor to fill it out for their loved one. And it's kind of the least intrusive in terms of all of the interventions that you can do if you need to assist somebody to manage their finances. Let's say they keep forgetting to pay their long-term care fees, and they need some support with that. You can get Service Canada to redirect that pension to a different person to be able to make those payments on their behalf. So that one, yeah, and yes, Bloom Group is currently not accepting any referrals at this time. They kind of got a bit overwhelmed with the amount of referrals that they were getting, so they've put a pause on that. And however, the public guardian and trustee is taking applications for pension trustee as well. I believe it's $100 a month that they charge for that service. So that's another option that you can look at. I'm just noticing another question in the chat that's kind of relevant. Some of our families who have signed a POA report that they still have challenges with the bank. Yeah, is there something we can assist with that? Yeah, it can be challenging. What I've done is I've contacted the bank manager and tried to set up a meeting to see like what the concern is. Sometimes based on the power of attorney document, it might say, you know, in order for this to be enacted, we require a letter from 2 physicians stating that this person is no longer capable of managing their finances. So sometimes that's what the holdup is, but yeah, it can be really challenging. Okay, so that's the certificate of incapability for Service Canada that has to do with finances. Now, not to be confused with the incapability assessment report. And this one is a Ministry of Health of British Columbia form. It has to do specifically with consent to facility admission. and has nothing to do with finances or whether the person is globally incapable. It's really just, do they have the capacity to consent to facility admission? And as a result, do they have the capacity to consent to discharge themselves? Or can they choose to move to a different long-term care facility? So that one is, I think it's 4 pages long, and it is completed by someone who's had the specific training for this, the consent to care facility admission. And they could be a registered nurse, a nurse practitioner, OT, psychologist, physician, but often it's usually a community case manager, so sometimes an RN or a social worker that completes it. But physicians are certainly welcome, and nurse practitioners as well. So this form needs to accompany the consent to facility admission, which is a mandatory form that we need for long-term care. And if the person who is, so if we're trying to admit somebody and they are not understanding what long-term care is, they don't understand what services are going to be provided, they're not really understanding what they're consenting to, then we need to fill out this, we need to get the assessment completed in order to be able to then offer the admission to a substitute decision maker. So that one is specifically for long-term care admissions, has nothing to do with finances or global incapability. And it doesn't, so there's a lot of confusion sometimes when people say, oh, well, this person's not capable of consent to facility admission, so when he's asking if he can go down the street to have a coffee, we should say no, because he's not capable. And that's incorrect. This is specific to, do they understand what long-term care is and that they are coming to live there and receive the services of the long-term care site? So it's a totally different question about whether they can go and have a coffee down the street and come back. Okay, the last one is the report of assessment of incapability. So you can see why this is so confusing. There's so many very similar forms with similar names. This form is, again, a British Columbia specific form. It has to do with finances, and it is completed by the health authority designate after the public guardian has received a report of financial concerns. Doesn't need to be abuse, but financial concerns under the Adult Guardianship Act, and they have requested the health authority qualified healthcare provider to come and do an assessment. It's a 15-page assessment on the resident or the adults. It's a functional assessment, so it asks them questions about, like, how do you do your banking? What can you tell me what taxes are for? These kinds of things to get a sense if the person is able to manage their finances. And so once that assessment has been completed, then this form will be submitted from the health authority designate. Usually it's a director with Island Health. And then that form then goes forward to say, okay, now this person is incapable of finances and the public guardian is going to take over. And so, yeah, lots of complex forms. Someone is asking, if someone is deemed incapable via the incapability assessment report, are they also incapable of signing admission forms at the long-term care site? Great question. Usually, yeah, it's a tricky one because we want to involve the residents as much as possible. So if someone's not capable of consent to facility admission, they may also struggle with understanding that they're signing the long-term care consent to treatment form and, the foot care nurse consent form. So what we try to do as social workers, because we're usually the ones that are doing the admission paperwork with these folks, is we will, invite the resident to sign the admission forms with their support. So let's say the resident has a health rep daughter who is supportive. What I would do is invite them both for the admission meeting and, go over the forms with both of them and say, okay, would you both like to sign it? And that way the resident feels like they're being involved, but also, if I have concerns about their ability to understand it, then their health rep is there as well. But it can be tricky.
Yeah, I just wanted to add,
Okay.
Kathleen,
Yeah.
that just to be clear though, that the CFA, so the consent to facility admission and the assessment report that determines who signs that, it is specific for that one decision. So it does indicate that maybe there could be a lack of capability in other things, but doesn't necessitate that they would be incapable. So we have to do that assessment, of capability around each kind of decision or form that we're having people sign. So it's a process, but it's important in helping people maintain as much involvement in what's happening to them for as long as possible. Mm-hmm.
Yeah, self-determination and
Yes.
feeling like, they are responsible for their own life, as much as possible.
Okay, so this is back to me. So, like I mentioned earlier, when someone passes away, we can also do advanced care planning for this. And so there's completely other legislation that determines.
Sorry, you're cutting out a bit again.
Thank you so much for letting me know. I will pull it up here. Okay. So alternate decision-making powers are governed by separate legislation. So for financial matters, this is mostly covered under the Wills, Estates, and Succession Act. So if the resident made a will and named an executor, they'll follow the instructions in the will for funeral, cremation, or burial. They should be the one contacted when a resident passes away, as a power of attorney's authority ends. This is the same for anyone who's being named as a health representative. So, and this information lives in the advanced care planning power form in Power Chart, which is the electronic health record program that Island Health uses. And so this is a snapshot of what that kind of looks like and what kind of information might have been in there. I'll let Kathleen explain where she got this example from. She made this Lord of the Rings.
My children were really into Lord of the Rings when I was making these slides, so I thought we could use Frodo Baggins as our patient/resident and kind of build his advanced care planning around the Tolkien trilogy.
Mm-hmm. So one thing to note is that when there is an executor named, they can act for decisions around funeral, cremation, and burial, and will also be usually managing the estate. So that's the financial side of things as well. So if the resident did not have a will, things get a little bit trickier. So it's always highly recommended that people do that advanced care planning and make a will. That is ideal. It simplifies everything, makes the process much quicker, and you get your wishes fulfilled in a much more easy way. But obviously that's not the case. And we run into lots of times when people do not have a will or an executor. So if the resident has family or friends that are willing to act to administer their estate, they need to apply to administer that estate. So this is the financial side of things. The people who can apply to administer an estate are listed under the law by order of priority. So similarly to the previous legislation that we mentioned, the spouse of the deceased is the first person who can apply, or they can nominate someone else to apply for this. If the deceased did not have a spouse, or if their spouse is unwilling or unable to administer, then a relative can apply. If there are no relatives willing or able to do this, then any other eligible person can apply to be the administrator. This may include a friend of the deceased or a professional such as a lawyer or accountant. The public guardian and trustee, as the official administrator for the province of BC, may also apply to administer the estate if no one else is willing to do so. This is generally only if the estate is on the larger side. So there is generally, if estates are, what I read is under $25,000 kind of total, it's a smaller estate, and there's a little bit more flexibility in terms of who will manage that. But larger estates, there's more stringent guidelines around who will be doing that. So if the person passed away in long-term care without a will and executor, so just to continue, this is what our part in long-term care is. During regular business hours, a social worker or another delegate, if there's no social worker available, needs to complete a referral to the public guardian trustee so that they can make an assessment to determine if their services are needed. If they decide that they will not administer the estate, usually, again, like I said, that state isn't big enough, or there isn't even enough in assets in the estate to pay the PGT fees or funeral costs, then they move on to the next step, which is if there's no executor and next of kin, then they will make a referral to the funeral services program with the Ministry of Social Development and Poverty Reduction. So this program can provide financial assistance with funeral costs and authorize funeral arrangements when necessary. So this process, though, when someone doesn't have next of kin and doesn't have a will or an executor, can take many, many months, very long time. And in this process, the resident's body will need to be transferred to the morgue and kept there until the Ministry of Social Development and Poverty Reduction can take action. So unfortunately, what this results in is morgue utilization for many, many months. So we really work hard in long-term care to try to provide people with education and breaking down barriers to access advanced care planning tools so that they can, not have this happen when they pass away and be in this situation. I see that there's a question about, are administrators paid? They can be, yeah, they can be. Sometimes that's detailed in a will, and sometimes it's worked out afterwards when someone applies to be an administrator. But yes, it can be. Okay, so my last point about this is that when we're talking about disposition of remains, we want to try to locate next of kin. So this is kind of aside from all the estate business. We have someone who's passed away, and we need to know who we can call to take things from there. So, if you're not sure who that next of kin would be, you want to consult with your social worker if you have one during regular business hours. You can also try contacting the health representative, power of attorney, or TSDM listed on the advanced care planning power form. So those people who are probably most connected to the individual may have information about who would be appropriate to be the next of kin or can act as the next of kin. And you can also check the advanced care planning power form for information about the funeral home. So the person may have chosen a funeral home or made pre-arrangements on their own. And you can ask the funeral director to arrange transportation so you can see if there's pre-arrangements made. You can also check the patient demographic record for the name of the funeral home. So these are just places to look for information if it's not clear who you might want to contact. All right, and next we're going to find out where you can find this information on PowerPoint.
Okay, so if you want to try and find this information, there are a number of different places where it lives in PowerChart. So I'm going to walk you through each one. So the first one that I like to use is under results review. And there is a tab for the most/advanced care planning power form. And this is where you can see the details very clearly. Frodo wants Gandalf the Grey to be his TSDM because he's his friend and he's the highest ranked. He's known him for the longest and they get along well. if Gandalf's not available, Samwise Gamgee will probably do as a next best choice. And then it looks like in this case, Frodo has chosen Lord Elrond to be his enduring power of attorney, which makes sense since he is immortal. So you'd want to have an enduring power of attorney who is immortal. And so you would find where the information lives. So what we do is if we get a copy of someone's power of attorney document, we always make a copy for the legal section of their chart, as well as we'll put the information in here about who is the power of attorney. Okay, so that's one place to find the information. Do I know if Point Click Care has something similar? Great question. I am not that familiar with Point Click Care. We're I don't know. Do you remember, Michele, when we were poking around on there recently? I don't remember if they have like a very clear, like, this is where you find this information. It might be under contacts or something. I'll have to look into it. But Power Chart it was built, the advanced care planning power form was built to make it really clear for people to be able to find. Someone else is saying, unfortunately, we get a lot of residents who have no arrangements and may maybe not capable of making their wishes known. So often we are having to go through the public guardian to assist with funeral arrangements, as there is no healthcare rep or TSDM. Yes, we're finding that there are a lot more folks in long-term care that may have been estranged from their families for a number of different reasons and haven't made funeral arrangements and done their advanced care planning. So there is a lot of interaction with the public guardian to assist with funeral planning for sure. Okay, so the other spot that's easy to look for is under the summary page. So if you're looking, I think, as your physician summary page or other different clinician that you have, summary page, if you click on the ACP, there's a form here that you can click on and it will pop up right there. So it's really, really handy. Okay, next slide. So there's also a section under the summary view for representatives, and the information from the advanced care planning power form in relation to healthcare decision actually pulls through to this section. So if you're quickly looking through the chart and you want to see, okay, does this person have a health representation agreement? Section 9, it will show up here who their health rep is. So that is good. We're trying to make it more accessible for physicians and for all the clinicians to be able to find this information. Another option is under Form Browser. So on the left-hand side of your Power Chart screen, you'll see a tab for Form Browser. And if you search by form, so if you sort it by form, it sorts it alphabetically. So advanced care planning will be near the top, so it'll be easy to find. If the person has made multiple advanced care plans, which I'll go into detail in the next couple of slides, but you should look for the most recent one because that should be the top one, and that is the most accurate. Okay. Okay, so the last option is to look under clinical notes. So also on your left-hand side of the screen, you can search under advanced care planning, and you will see it's kind of laid out in a different way, but it's very clear that Gandalf is the TSDM for Frodo. And okay, next.
I think that's
Oh yeah, go ahead.
So yeah, so those are all the many ways that you can find the advanced care planning power form in Power Chart. And now, if you need to create or add information to an advanced care planning power form, we ask that you never modify an existing form. So many providers will be able to have access to creating these forms within PowerChart. But we ask that you always create a new form, and you can do so by clicking the button under the advanced care planning section of the main summary landing page of a residence chart. So that will open it up, and it should pull through information from the previous one, but there's kind of a trick to keep that information there. So we'll go through that. So when you click that and open it up, it looks like this. So please check all the sections to make sure they will pull through. So the information will preload there, but it will not publish on your form when you sign it unless you click through each of the tabs. So you can see on the left-hand side of the form there, they're all grayed out. That means someone has gone through and clicked each of them. And so all of the previous information that we need around consent to treatment and financial and legal planning will be continued through to the new form. The goals of care narrative, as is shown on this slide, is most often the section that's updated by team members who are not social workers, which is amazing. It's a great location to have this information if you're having goals of care conversations with patients or their family members, because it shows so prominently in the chart. This is a great place to put it. But we just ask that you also click through the rest of the information so that it stays on the most recent advanced care planning power form. It's also a good time to note that if you come across a form that seems incomplete or does not have the information we're looking for instance, there isn't a section about consent to treatment, but you're looking for that, you might need to go to a previous form that someone has completed that maybe it wasn't pulled through to the most recent one. So you can do a little bit of digging to find what you need if it's not on the most recent advanced care planning program. So here's a close-up of the financial and legal section. You can see all of the tabs are grayed, so they have been clicked through. It also gives an example of the exact location of the physical document. So Kathleen kind of pointed that out. This is where we will put exactly where that legal document, a copy of it, lives in the chart, because we should not be putting in this information until we have a copy, physical copy of that legal documentation. And I believe that nearly draws us to an end of our information. So just a quick conclusion. Kind of the takeaways we were hoping for you today was that to determine alternate decision makers for incapable adults is outlined in legislation. So we need to follow the processes outlined. Healthcare decision-making and financial decision-making powers are granted under separate legislative processes. Similar though, but different. There are many options for alternative decision makers, and each has varying decision-making powers. So it's important to understand the different types of advanced care planning options out there. After someone passes away, the powers of committee, POA, representatives, etc., stop, and it transfers to an executor if there is a will. And information about these advanced care planning options can be recorded and found in the advanced care planning power form. And if you're using, if you're not using a PowerChart and using another, program like Point Click Care, and it doesn't have this information, that would be something to advocate for. We find it so useful across our programs to have all of the advanced care planning information in one location that's easily accessible to everyone. Laura's asking, can this form be printed? It can off of PowerChart. You can print the form. Yes, I believe it can be printed. Don't ask me how. Yeah, I think you go into PowerChart and there should be a way to print power forms. Yeah. All right. And then last but not least, we just have some helpful resources for your future in supporting people with their advanced care planning. Lots of links that hopefully will be accessible through the slides when we send them out. And then it has also our information. Feel free to reach out anytime if you have questions about advanced care planning. And then, like Kathleen gave a plug for it at the beginning, tomorrow is Advanced Care Planning Day. So there usually are some initiatives to spread awareness about the importance of advanced care planning. So you might see some more about this tomorrow in various organizations. Right, so thank you everyone so much for your time. I think that is the end of our presentation.
Yes.
Right. And I believe we now have time for some questions. If anybody, I wasn't sure if there's anything in the Q&A or anything else in the chat.
This is David Clinton Baker. I'm a family physician in Victoria.
Yeah, go ahead, David.
I work in two different facilities, two different long-term care facilities, very part-time. So sort of simplistic, I guess my simplistic way of thinking has been when I will ask one of the nurses or the healthcare team, is there a health representative, all right? And then if there is, that's the person that I liaise with. What I'm confused about is how does that relate to the substitute decision maker process that you're talking about and being a health rep? Are they one of the same thing?
Did you want to take that one? Oh, you're on mute. There.
Oh, okay. That's a great question. It's all part of the same kind of area, but a health representative is higher ranked than like a temporary substitute decision maker. So, if somebody has already, been to a lawyer or notary and written out that these are their wishes, that if they are incapable, they want their daughter Jenny to be the one making healthcare decisions. We need to go to Jenny if we're concerned that the resident's not understanding. We don't then go back to, oh, okay, let's look at, does she have a spouse? Because if this resident has chosen her daughter Jenny to make the healthcare decisions formally and legally, so we have to go to Jenny and not go to the spouse and then go through the rest of the list. Yeah, I don't know if that answers your question or if you have anything to add, Michele.
No, I think that was pretty clear. Yeah, there's some really helpful, I think, documents in our links to that kind of outline the ranked order. So it's all part of the same legislation. It's just that some people have legal authority, whereas the temporary substitution decision makers, like Kathleen said, are temporary. So they're not all necessarily always the same. So it can change depending on who's available and who's most senior at the time.
Okay, so a health representation agreement has to be signed off by a lawyer or by a notary?
And not technically, to be a legal binding document, it needs to be witnessed by two people, but in most cases, people will choose to have a lawyer as one of those witnesses and draft it up. Tends to go better if things get tricky.
You can certainly make your own. There is a website about advanced care planning called My Voice, and it does provide you with the forms that you can print off. And as long as you get to monitors and witnesses that are not named in the document, technically it's a legally binding document. But if you have any inkling that maybe someone's gonna be frustrated or feelings are gonna be hurt, I would definitely go through a lawyer or notary to really just get that stamp on there and make sure that it's all official. Because things get complicated when there's family members that disagree, and you want to really make sure that you're being as clear as possible about who you want to make healthcare decisions for you and financial ones.
Thank
you. I can see another question in the chat that I don't think we answered. Does having financial power of attorney give a sibling priority in medical decision making? So that's a no. Yeah. Even though it might seem to make sense that, that sibling who has power of attorney might be a trusted adult that person had appointed to manage their finances. there could be a lot of reasons why they might not want that same person to be managing their healthcare decisions. So no, it doesn't kind of bleed over into another type of decision making. Could be the same, but not necessarily. The fact that they're a power of attorney does not give them priority over medical decision making. More questions? Okay, to piggyback onto that power of attorney question, it seems like all of our nurses have been taught that the power of attorney is decision maker. I would agree that come across that a lot. And in other provinces like Ontario, a power of attorney can be named as a decision maker to make it even more confusing. But in British Columbia, a power of attorney is only financial and legal. So yeah, hopefully you'll take this as an opportunity to help educate all of the nurses that you know about power of attorneys, because they do not have authority over financial decision making unless the power of attorney was made in another province and specifically states that they can do so.
Yeah, it happens a lot. And you know, nurses and physicians want to, you know, they want to do their best, and they, you know, for some reason the word power of attorney just seems to hold more clout than health representative. And so people think, oh, well, I checked with the power of attorney and it's fine that you know, we're gonna stop treatment and they're discontinuing dialysis. And it's like, whoa, you can't ask a power of attorney about a financial or a healthcare question. You really need to make sure you're asking the right person. So this is part of why we wanted to do this presentation, is to really spread that awareness that power of attorney, you should really only be charting power of attorney or having any kind of medical documentation that says POA if you're talking about you know, this resident requires a special kind of medication that is non-formulary and it's going to cost them extra, and there's financial concerns about whether they can afford it. Then it would make sense to consult with the power of attorney and say, hey, what do you think? Do you want, do we want to be able to pay for this? Or if they need foot care nursing and it's going to be expensive, or if they need their taxes done, then that's a power of attorney relevant question. But if it has to do with their healthcare, it really should go to the capable adult, the comitative person, health rep agreement, or TSDM, in that order.
Great. I can see that Laura has a question. Go ahead.
Yeah, I just had a question. Somebody mentioned other provinces. If someone comes in with an agreement from Ontario because they're here on vacation, does that hold weight here?
Yes, yeah. Yeah, so that can be part of why it's important to actually see the documentation in your hand, like the
Right.
physical copy of it, right? So you can read what it specifies in terms of powers, because they're not all the same. Some will have different things in them. So if you see it's made in Ontario and these are the things, then yes.
So you got to play by their rules, as it were.
Yeah, yes, yeah.
Okay. Thanks.
There's another question from Ryan in the chat I can see. Can you use a bank trustee with a power of attorney as a medical decision maker if no one else is available?
No, no, no. There's always another option, and the public guardian and trustee's office also takes calls about healthcare decisions. They want to be the very last resort, the last person you call, but yeah, no, we would not take direction from a power of attorney for a medical decision, because we would have to definitely go to the public guardian for that question. Then the public guardian can also consent to facility admission for people if they don't have a temporary substitute decision maker or any of the other options. So we really wouldn't just go to a bank trustee. Oh, I hope that hasn't happened.
questions? Yeah, any hands up? Feel free to come off mute if you want to ask anything else.
Nope, it's the law across British Columbia. So if they're in private, so the question in the chat for those who can't see it is this different in private versus public care? And the answer is no. So it's, you know, the legislation is British Columbia legislation. So whether they are in a private facility paying $14,000 a month or in a subsidized Island Health facility paying based on their income, it doesn't matter. The rules are the rules. Do you want to expand a bit more about that, Ryan? Seeing any more messages in the chat about that, but yeah, I think something that unfortunately happens is in private facilities, they don't tend to have social workers. And we are kind of the keepers of this knowledge as it were. So I think we have a few things to review at work. Yes. Yeah, I'd be happy to help support you with that. We as social workers get involved in these kinds of really kind of sticky, unclear, very gray matters. So it's something that we are familiar with, but I can appreciate that if you work in a site that doesn't have a social worker, that it might not get addressed in the legal way that it should. So yeah. Thanks for sharing that, Ryan. Nice to see so many different clinicians on here. I'm seeing some pharmacists and some occupational therapists, some nurses, family physicians. Yeah, it's nice to see so many people here.
So this is David Clinton Baker again. Can I ask another piece of advice?
Yes.
Okay, I've been asked to do an evening presentation at a club that I belong to here in Victoria, completely unrelated to healthcare, and it's about advanced care planning. And they have a group in this organization who they meet once a year, and it sort of looks after welfare of members, and if members pass away, there is support offered, etc. And they've decided that the topic this year in their meeting next month in May is going to be advanced care planning. And I've been asked to be the one to come along and be a resource. And the proposal was for the people there to fill out an advanced care planning, to fill out their own advanced care planning. Now, how do you think I would be best, how would that be best organized? It's about an hour-long meeting.
I could start this one, Kathleen. So like you asked before, a lot of this advanced care planning to hold weight if in case it's being put in question requires a lawyer. So maybe some of the options that they want won't be available in that meeting, but it's always beneficial to anyone at any age. And I recommend this to everyone on the call to start thinking about what kind of options you want. So for example, you might work through having them think about who they would want to make decisions on their behalf for legal and financial matters or healthcare or both, what kind of things they might want to think about in their will, who they would name as their executor. You can provide some information about all the options on, managing healthcare, managing finances, and estates after someone has passed away, and then work through what you would want, because it can be really helpful to take that information to a lawyer or, you know, a notary to put it in a legal document for you. And it really is recommended for adults of all ages. That's part of the initiatives tomorrow at Advanced Care Planning Day, that you know, everyone should have these sorts of things in place, not just those kind of nearing the later stages of life. I hope that helps answer your question.
No, that's yeah, that's helpful. Thank you.
Okay, maybe Kathleen had more to add. Other ideas.
Yeah, I was just going to add that the My Voice booklet is a good place to start too, that you can get online and print off the forms. And then that at least gives them kind of the frame of reference for what the lawyer or notary might ask, so that they can come prepared and hopefully save some money for the lawyer's fees. I could tell you, I've had, you know, I made my power of attorney representation agreement and my will. And I think it was like maybe 1,500 in total. So it was a really good investment. I refused to give birth to my son before I had all of those things in order, because as a social worker, I was working one day at the maternity unit where a patient, a woman in labor, had a stroke while she was giving birth and was not able to communicate what her wishes were. And that really stuck with me, that I would never want to be in that position, of course, but if I was in that position, I want to know, you know, want to make it very clear about who would be making decisions for me if I was unable to make them myself. So you don't need to wait till you're in your 70s or 80s or 90s to make these plans. You can do it as soon as you're able, as soon as you're an adult. So I would highly suggest you do it, and your future social workers will thank you for your clarity and forward thinking and getting this done, because you'll make our lives so much easier if it's very clear if who you want to be making decisions for you. There's a great question in the chat from Madison. Would you suggest having a sit-down advanced care planning meeting with families when their family member is moved into long-term care if they don't already have something in place? Or would you suggest just providing them with the resources to complete it themselves and be a support to them if they have questions? That's a great question. The admission process to long-term care involves some there's kind of certain checkpoints along the way where the case manager will ask, okay, who's managing finances? And so that kind of comes up naturally during that process, because the person will need to sign that they agree to the long-term care rate before they get waitlisted for long-term care. So that's kind of a spot where that can happen. And if it's not in place by that point for the finances, that's a good opportunity to talk to the adult and their family about making that document. The healthcare decision document, yeah, that's a great question, because ideally someone is moving into long-term care with both of those documents. That's kind of the perfect scenario. If we're aiming for perfection, as someone showing up with a POA and a Rep 9, because that way we know who we're going to for both of those decisions. But if the resident is still capable and wants to be able to manage those things themselves, then I would suggest just providing them with the resources and the information and support them if they have questions. It's not mandatory that you need to have these documents in place for long-term care, but it certainly helps.
Yeah, I just wanted to add that the biggest part for me is just ensuring that folks know what options there are and what might happen if they don't, you know, choose to pursue advanced care planning. So, you know, if you're talking to a capable adult who hasn't done any of this planning, and you know for sure that they want a specific person to be making decisions for them in the future, and it maybe isn't the highest ranked temporary substitute decision maker, then I would inform them about, what might happen if they become incapable and suggest, a meeting maybe to sit down, but only in that kind of specific scenario. If it's an incapable adult and they're, someone in their life, their support person is asking about, advanced care planning, again, you might want to suggest resources, and you could suggest having a meeting, but generally it's providing those resources to them. Sometimes these conversations can be really tricky, especially for kids like the adult children of residents who haven't done advanced care planning, and now, they've never really had to look at or think about, the end of their parents' life or their friend's life. And so it can be really tricky to navigate those conversations, but it's important to make sure that they have access to resources if it's something that they want to pursue, so that, when the person, especially when the person passes away or a tricky decision comes up, that this is being pre-planned and decisions are made ahead of time. So it just takes away that stress in those kind of more high stress situations. Yeah, and then Madison just added, I would say majority of our residents don't have representation agreements when coming into care, and I'm providing them with as many resources as I can. Yeah, it's a lot of work and a lot of information for people too. I mean, yeah, ideally it's happening earlier, and I think that's part of the reason that they have like an awareness day, but maybe it should be an awareness week. So many people neglect to kind of look at that.
Does anyone have any more questions? I think we're getting close to the end of our time here. Okay. Kathleen or Michele, is there anything else you want to say to wrap it up?
Yeah, I just wanted to thank everyone for coming. One of the things that is really special for me as a social worker working in long-term care is when I'm meeting with a new resident and they provide me with their information about who they want to make decisions for them, and I put that information into Power Chart. It is so nice to be able to see that, if that same resident ends up in the hospital because they've had a fall and they've fractured a hip, that the physician in the ER can see my note and say, oh, okay, this is who we should be calling. And we're really honoring that resident's wishes. And so I'm just so glad that we have that that information that crosses across the different encounters, whether the person's in the community, long-term care, or in acute care. So I'm just so glad, and hopefully people will know to look for that power forum so that they can get that information as well. Anything else, Michele, do you want to add?
Yeah, I just wanted to reiterate the thanking everyone for the time and attending and the curiosity and sharing, scenarios that maybe you've run into. Really appreciate that for the learning experience for everyone. But yeah, keep in mind that there are resources out there. And yeah, if you work at a site that doesn't have a good system for relaying this information, like we do and through Power Chart, I would highly suggest trying to address that in ways that you can. It's really meaningful for people when they can have their voices heard. Thank you so much.
Great. Thank you both so much for joining us and for presenting. We really, really appreciate it. We'll make sure that all of this information gets out to all of the attendees, and then the recording will be available on our website as well. So yeah, thank you again. Have a great evening, everyone.